Let me ask you something. When you hear about hair transplant, what's the first thing that comes to your mind? Most people will say, how many grafts? 3000 graft, 4000 graft. More graft must means better result, right? Not exactly. Here's the truth. Most clinics don't talk about. Your final result depends far more on slit making rather than on graft counts. Hi, I'm Dr. Prakash Khute, your friend and hair transplant surgeon. And today I want to talk about one of the most important and most misunderstood steps in hair transplantation, that is slit making design. Because if this step is done right, the hair looks completely natural. If it is done wrong, even 4000 graft won't save the result. So what is slit making? At a basic level, it's basically creating tiny openings in the scalp where the hair follicles will be placed. But honestly, calling it making holes is an oversimplification. Slit making actually decides your hairline shape, direction your hair grows, the angle it comes out of the scalp, the density, and even long-term growth. In short, slits tell your hair how to grow for the rest of your life. Now let's talk about the most critical area, the hairline. The natural hairline is never straight. It's slightly irregular and it must be designed according to your age, your face shape, and considering your future hair loss. That's why at the very front, we use only single hair graft and place them at very flat angles. If the angle is wrong, the hair stands up. And the moment that happens, the transplant looks fake, which brings us to angles and direction. Hair doesn't grow straight out of the scalp. At the front, it grows very flat. In the middle, it grows slightly upward. And in the crown, it grows in a circular swivel. So if slits are made at the wrong angle or direction, the hair may grow but it won't look natural. That's where you get that doll-like appearance people are afraid of. Now let's clear up another big myth, the density. More is not always better. The scalp has a limited blood supply, and if we create too many slits too close together, graft survival actually drops. That's why we plan carefully. High density in the front, gradual transition toward the back, and a special pattern in the crown area. This creates fullness that looks natural and keeps the scalp healthy. So why does surgeon skill matter so much here? Because no machine can replace artistic judgment, an understanding of facial aesthetics, and a real experience with hair direction and growth patterns. That's why experienced surgeons often spend more time designing slit than extracting grafts. Because in the end, grafts are just hairs. Slit making is what turns that hair into a natural result.